Your medications have been sent to your pharmacy electronically. Please have your driver pick up these medications, or please pick up your medications ahead of time if we have sent them prior to your appointment. Following the procedure, there will be gauze in your mouth where the procedure was performed. Please remove this gauze prior to heading to bed or taking a nap. This gauze must stay in place for at least 1 hour following the procedure. Extra gauze will also be provided, and if needed, please place the gauze for an additional hour on the extraction sites following the procedure. During the procedure, local anesthetic has been administered. This local anesthetic will continue to keep you comfortable, typically until you can start your pain medication. Please start your pain medication as prescribed. Most people can expect some bleeding, some soreness, and some inflammation following the procedure. Please follow the postoperative instructions provided so that you may minimize the amount of discomfort that you experience during your recovery. Please avoid any suction in the mouth, including the use of straws, smokeless tobacco, and cigarettes. For diet following the procedure, please stick to foods that are very soft, very creamy, and very smooth. Please avoid things that are crunchy, crumbly, hot, and spicy, or things that have a lot of seeds inside them, such as berries. Consuming foods that are crunchy and crumbly or foods that have a lot of seeds will contribute to food impaction in your procedure site and can lead to infection or a delayed recovery. We recommend that following each meal, you gently rinse with warm salt water. At your follow-up appointment, we'll provide a syringe that helps you clean your procedure site more thoroughly. However, do not use any syringes or water picks within 1 week of your procedure until advised by Dr. Dillon. Please refrain from smoking for at least 1 week following your procedure. Swelling is a normal part of the healing process. However, swelling does not typically take place until at least 24 hours following the procedure. Most of the time, your swelling will peak around 48 to 72 hours following the procedure itself. This swelling should gradually decrease over time. If your swelling has gradually increased during this time, if you have developed fevers or any kind of drainage, please let me know so I can advise you further. Please avoid any strenuous activity such as jogging, exercising, or sports for the next 5 to 7 days. Do not brush the teeth near the surgery site for the first 48 hours. Other areas of the mouth may be brushed, paying special attention to avoid areas that have recently been worked on. If I have advised you not to take some of your medications prior to procedure, you may resume taking them the day of following the procedure. Bleeding afterwards is normal. If there is continuous oozing of a particular site, please fold up one piece of gauze and bite firmly for approximately 1 hour. This should help alleviate any sort of continuous bleeding. Please contact me if bleeding is excessive, swelling is continually increasing after 72 hours, if your fever is rising more than 100 degrees Fahrenheit, or if you have difficulty swallowing or breathing. I know it's a lot to ask, but following these instructions can help you prevent dry sockets, infections, and other complications throughout the procedure. All these things are geared towards helping you recover as fast as possible. These videos are very helpful for you to be prepared for your scheduled procedure. However, these videos are not a substitute for the consent forms and preoperative and postoperative instructions that we have sent to you. Please review these documents ahead of time so that we may answer any questions that you may have.